Please give a warm Farm Bureau welcome to Senator Rand Paul. Thank you, sir.
Thank you. I think sometimes we think, oh, we're only going to talk about farm issues when we're at the Farm Bureau. But I thought this morning I'd talk about something that I think also connects all farmers, but really all Americans, but has peculiar aspects to farmers, and that's healthcare. So I thought we'd start out with a poll and see how awake everybody is. How many gets their health insurance through the Farm Bureau? Show of hands. All right. How many gets it through a spouse? How many just sort of buys it on their own individually? All right. So about a third, and a third. I'm introducing a replacement plan for Obamacare. I think Obamacare has been a disaster for those who buy in the individual market, and everybody that raised their hand probably, unless your spouse, get it through your spouse, buys it through the individual market. This is a small percentage of people, but a high percentage of farmers. What's the problem in the individual market? Under Obamacare, there's like one insurer left in about half the country, and the prices have gone through the roof. So the average premium in the individual market, which is many of you who raised your hand, has gone up 25% in Kentucky last year. Tennessee, 63%. Across the country, enormous increases in premiums. So my replacement is this, and this is incredibly powerful, and I want you to think about it, and since I got the American Farm Bureau here, I want all of the Farm Bureaus to think about it. I don't want any of you, not one of you, to be left buying individual insurance. I want you all to be able to join an association, and through an association have the leverage of your numbers. David was telling me that you have about 30,000 lives in Kentucky through the Farm Bureau, but you all have individual policies. So 30,000 of you are buying your insurance individually. But what if 30,000 of you were together in an association and you appointed someone from the Farm Bureau? Even better, not just Kentucky, the entire American Farm Bureau had a health association. You join it, and now you get group insurance. What's the difference between group and individual? In the individual insurance market, if you or your spouse get sick, or you get a family member that gets cancer, your rates go through the roof because the insurance companies treat you as an insurance pool of your family. That's ridiculous. You are bigger than Toyota. You're bigger than General Motors. But they all get group plans and you get individual plans. This is as simple as it comes, and it fixes the majority of the problems. Some of it I think you could even look at now because there are state associations. So you could look at it from Kentucky and try to say, we're going to negotiate with the insurance company as a block, not as an individual. This is a huge idea and a huge part of what I'm trying to promote for replacement. It involves changing some of the laws. President Obama thought that it was a terrible idea that you make decisions or join associations, so he pretty much banned this. Used to be other people could join associations, but it's very, very strict. We changed the laws to make associations bigger, easier to join, and go across state lines. If this would happen and the American Farm Bureau gets involved in this, you might have 100,000 people. You might have 1 million people. Then guess who the servant is? The servant becomes the insurance company. The insurance company, has anybody ever been mad at the insurance company or mad at their health care? My wife's mad every day paying bills. Paying bills, it doesn't cover anything, costs a fortune, and everybody's mad about it. But you know what? Before Obamacare, a lot of people were mad too. The system doesn't work. We need to fix it. So I've said I'm for repealing the whole thing. I don't think we should repeal part of it, repeal the whole darn thing, but replace it with something that will work. If you had 100,000 or 1 million farmers buying their insurance and you had one negotiator, the insurance company will work for you. You'll get guaranteed issue, you'll get a great price, they're not going to drop you, and you no longer have to worry about getting sick. Well, we all worry about getting sick, but you don't have to worry about your prices going up or being dropped by insurance. I think this is a huge idea. Doesn't involve any government. It involves getting the government out of the way. The second part of the replacement plan that I have is expand health savings accounts. Let you save for your insurance with a tax-deductible health savings account. I'd even put a tax credit in there. In a real marketplace, if you put tax-free money away in your health savings account, let's say you were able to put $10,000 away every year through a tax credit in your health savings account, you could get a $10,000 deductible. In a real marketplace, what does that mean? You're like, oh, I don't want a $10,000 deductible. Well, what if your premiums were cut by 20? What if you were paying $1,000 a year instead of $10,000 or $20,000 a year? In a marketplace, that's what works. Under Obamacare, you got higher deductibles and higher premiums. That's ridiculous. That's not the way the marketplace is supposed to work. A real marketplace, higher deductible, lower premium, you'd make that choice. Many farmers are successful and know how to save and are responsible people. You'd probably use your health savings account, get higher deductibles, still could all be done through the Farm Bureau and Association. The third thing you have to do is you have to get rid of the mandates. You have to let consumers let you buy what you want. So for example, if you're 25 years old and you just got married, you probably want pregnancy coverage. But if you're 45 years old and you've had your children, you may not want pregnancy coverage. If you're 75 years old, you really don't want pregnancy coverage. All of the mandates under there, President Obama said, oh, we must mandate this so everybody has great insurance. Well, you know what? If you mandate that, it costs money. So what he did is he priced people out of the marketplace. So young, healthy people aren't buying it because he said, when you get sick, you can go buy it. So people aren't so stupid as politicians think. They just quit buying insurance and they waited till they were sick. And then they'd go in and out. People are going in and out of the insurance market 4 and 5 times a year. There are ways we can fix it. I think if we are for repealing it, we ought to be for replacing it. I'm for having the vote on the same day. Now, I've been in the minority, but I'm pushing forward. I want to repeal the same day, complete repeal. We've already voted on this once. Every Republican voted for complete repeal. Now there's all these rumors afoot that people are tinkering with it and let's keep part of it. If you keep part of it, it gets worse. It may well get worse because they've damaged the marketplace anyway. You got to get rid of the whole thing and let's vote on a replacement package on the same day. Where you can help is if you like the idea of never being left on your own again to buy insurance in the individual marketplace, if you want to have group insurance, even though you're an individual farmer, talk to these guys and get them to endorse my replacement plan because I need help in the Farm Bureau. An American Farm Bureau would be big, but Kentucky Farm Bureau would be a start. If we could actually endorse a replacement plan that would really help farmers, that's what I'm for, and I hope you're for it too. Thank you very much.